innovation, strategy, and advocacy, combining to increase community-based services. Welcome to the CarePayments Pod. With me today is Dyann Roth, President CEO of Inglis. Welcome, Dyann.
Hi, how are you doing, Fady?
I'm delighted that we can do this. You're able to join us today. So, Dyann, you lead an exceptional organization where you're making some real changes to increase community-based services for people with disabilities. Tell us a little bit about Inglis and the transformation you are leading there.
So Inglis is a very historic organization based in Philadelphia, but serving the whole Commonwealth of Pennsylvania. And we have started with and continue long-term care services for people who utilize wheelchairs, people with very complex physical disabilities and medical needs. But we've been doing housing, affordable, accessible housing for about 50 years, and community-based services for about the same 5 decades. At this point, we are really focused in on housing because what we know and what we hear every time we ask people with disabilities is the greatest need they have is affordable, accessible housing in communities that are accessible as well. So that's our North Star. We're really focused on housing, but all of the elements that lead to independence in their communities. So we're really focused in our community-based services on the use of technology, assistive technology, home modifications, employment supports, and how we integrate all of those, right? So how are we making environments work for the people, and how are we making technology really serve their goals?
Wow. You've been doing this for 50 years as an organization, and that seems like a very nice journey. What are the key strategies you're employing to make the changes that you want to affect happen?
Well, I think first we're staying curious, right? I think during these times of sort of turbulence in the regulatory and funding streams, it really requires just staying curious, staying focused on what problems are we trying to solve, who are we trying to serve, and what do they need. And so from there, we're really kind of exploring what technologies are emerging, how are people using them, what are the gaps, how do we shift mindsets of our payers, of the people that we serve and their loved ones. So we're really trying to do, in some ways, a system change process, to be looking at technology as a tool for the future for all of these service lines.
Well, technology as a cornerstone for a lot of what you're doing, and but you're also finding this interesting way of combining your strategy and advocacy with that innovation aspect. What are some of the obstacles you're facing, and who are the people who are most supportive, or the systems that are most supportive at this time?
Well, I would say from the mindset shift of the role of technology in human services, I believe that the intellectual and developmental disabilities systems in many states, not all states, but many, and including Pennsylvania, are a little bit leading the way. Part of that is due to the workforce crisis that has, really gotten worse since COVID. But it's also about the everyday lives, kind of person-centered. How do we really foster independence and self-determination? And so technology playing a role both in the provider organization's operations becoming more efficient and cost-effective, but also the service delivery being much more person-centered and enabling people to be independent with supports. um, having staff move from caregivers, caretakers, to coaches more.
Yeah.
I think that the aging and other disabilities service lines and organizations are not quite as leading the pack on that. And one of our goals as advocates and as an organization that's been focused on people with complex physical disabilities and older adults, we're really trying to lean into that area and help both our government officials and our payers, our community health
Mm.
choices in Pennsylvania, payers really understand the role of technology for their constituents.
So, Diane, that's very interesting. I want to probe that technology aspect first. I
Okay.
started out in business, and 10 years ago, when we talked about technology, it involved the web and dot coms and so on, 20 years ago.
Hmm.
Uh, what's technology today that you're referring to? What is the technology that you're integrating into the services that increase independence and make it more likely to succeed independently in the community?
Well, it can be anything from your basic, almost commercial, off the shelf smart home package, but customized for what that person and or their um, family, caregivers, the circle of support
Mhm.
uh, really need to stay in touch with each other, to do telehealth where that's necessary. There's a lot of different kind of sensors and other kinds of tools that enable someone, whether it's an older adult or it's a person with,
Mhm.
mobility difficulties, to um, manage their environment, have the support when they need it rather than 24/7 when we don't have the workforce to provide that, and and also to really connect with emergency services when they need it. Um, I think that technology is not a substitute for human uh, caregiving, but I do believe that sometimes we rely on a person to be there just in case rather than just in time. And I think that's the shift that we're trying to figure out together.
So, Diane, it sounds like technology has become that aspect of innovation that is being personalized for the people we serve. And but there's another part of what you do that is very unique, and I want to make sure that folks understand that it takes a lot of leadership, both within your organization and the community. Share a little bit with us about your leadership style and how that's uh, brag a little bit about yourself, because I feel that you do amazing job with that in bringing both stakeholders as well as your team to get behind what you feel is important to get done.
Well, thank you. I do. I believe in collaborative leadership. So I think that um, what I try to do, and I think what Inglis really tries to do, is be a convener. Bringing the parties together, whether it's my own team or our team working with other organizations to really kind of bring our strengths together and find out what's possible together. We're doing the same with payers and regulators and trying to set the table without a lot of preconceived notions about what will come out of it, but willing to take the risk of bringing the right people together to make solutions and policy and legislation when necessary happen.
Wow. And that takes a lot of hand holding and a lot of sometimes convincing for people to understand the big picture, because we're
Yes,
all
yes.
sometimes focused on what rates are we getting, or how many people we're serving and what our billing and revenue cycles look like. And you seem to have shifted that conversation a little bit, and that strategy that you've brought to the table seems to have been well thought out. What do you see as the next phase of this?
Well, I do think bringing more of our government partners and payers to the table to help them understand and really get what technology can do, what partnership of organizations can do, rather than kind of keeping us siloed. And I think that it's about changing mindsets. I was reflecting earlier today on, being part of, in Pennsylvania, the first shift in the intellectual disability system from county funded, program funded, which was basically like almost grants, to
Mhm.
fee for service. And we knew that while we were doing that massive change, which was like mind blowing to most people in this field, that was just going to be a blip, and we were going to be working on value-based and kind of other sorts of models of payment before we were really fully into fee for service. So I do think it's about trying to look 5, even 7 years ahead. Not that we have a crystal ball, but we can't just be designing for today. We've got to be looking ahead. It's a little hard in this particular environment because we don't know what's going to happen with some of the major funding streams, but
Mhm.
it almost forces us to be even more innovative.
Wow. You know, we will continue to work on this together. And I hope that sometime in the near future, you'll come back and tell us how your journey is continuing.
I would love to. Thank you, Fady.
And for all of our listeners and audience members, hope you get the message that Dyann and I are trying to get out there about all the supportive availability of both leadership and strategy to guide us into the future. And as always, onward.
The Care Payments Pod is brought to you by XtraGlobex. XtraGlobex is a strategic consulting firm that works with companies that are at an inflection point. We work with organizations to help manage that change and meet your goals. What is your challenge? Let us help take you onward. Link in the bio for a free consultation. Visit us at XtraGlobex.com.